Hello, welcome again to class. Thank you so much for staying again. Thank you. It's another edition of Poultry Science. And I thank you for sharing, liking, subscribing, and also following. Now, today we continue on what we started last week, the last class. That was infectious bronchitis. We said previously that it is actually a viral disease. That is a virus causing the disease, and it's a respiratory disease. That is, it affects the respiratory tract and also causes difficulty in breathing, in which case we looked at the signs and symptoms. Difficulty breathing, animal loses appetite, and then you see chapping noise and pew pew chew 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 in animals. And then there's also whistling in the lungs and the nose. The animal will begin to whistle, especially in the night. You begin to find that the animal is unthrifty and the animal loses weight, and so many others. Now you want to look at the previous video so you get a full understanding of what we talked about in terms of the signs and symptoms of infectious bronchitis. Now we go to what we have today, the mode of transmission. So we'll be looking at the mode of transmission, and then the treatment, and then the prevention. Now, like I said previously, last class I said that viral ailments, viral diseases are not mostly treated, but they can be managed. More often than not, you have to look at biosecurity measures and then vaccinate when the animals are very young, and also in between after some days. Now, mode of transmission is airborne. Usually, most viral diseases are airborne, especially those that have to do with the respiratory tract. They are airborne. So, unsanitary condition and also not having proper ventilation can lead to this. Now, what is the treatment? Like I said previously, no particular treatment for it, just like some other viral diseases. However, antibiotics can be given to prevent secondary infections. Now, what happens is this. Now, when an animal is infected by the virus that causes this, the infectious bronchitis, the immune system is compromised, and so the animal is weak in the immune system, exposing the animal to bacterial infection. Now, the viral infection brings the immunity down, and then bacterial infection begins to come. Now, when treatment is given with the aid of an antibiotic, the antibiotic is to fight against bacterial infection, other ailments that we want to come, so that the animal may probably lengthen the animal's life, the animal may survive in the process. Now, we'll see that if it happens that chicks are affected, the chicks' breathing temperature can be increased slightly, because the presentation of bronchitis, infectious bronchitis, is also with a kind of cold. The animal feels cold. You already know that. We already talked about the fact that how is it that you know when a human is cold, you see the throat, it's the chapping sound and all those things. So almost the same thing happened with chicken. Now, how do we prevent it quickly? We talked about the two effective parts, by vaccination, and as a matter of fact, biosecurity measures. Now let's talk about vaccination. The birds are vaccinated day old, and more often than not, IB, infectious bronchitis vaccines are most times put together or administered together with Newcastle disease vaccines. So you have them as IB and ND. So they are administered also in the hatchery, when the chicks are day old, at other times between 8 days to the 36th day of age for chicken. Now, what about biosecurity? Effective biosecurity measures. Now, let me say this. These biosecurity measures are almost endless. They mean that you take deliberate effort to prevent, to protect, to secure your animals from biological pathogens, pathogens of biological origin, of course. So all those disease-causing microorganisms, you make physical efforts to prevent them, apart from giving drugs or vaccines and the others. Now, what are those things? For example, you make sure that there's proper ventilation. Number two, you make sure that people handling the birds are handling them, they are clean. You make sure that there's food dip in front of the pens, and so you dip food there. There's proper disposal of dirts around, because dirt can be the hiding place or breeding place of vectors that carry these viruses. So, for example, flies. Some flies may have some of these viruses. They perch on the feed of the animal. The animal eats the feed, or maybe just spread these things around in the atmosphere and then they break them in. So you clear those places. Also, you make sure that animals that die as a result of any disease, you dispose them properly. Not necessarily this, any disease at all, dispose them properly. Dispose means you dig the ground properly, you bury deeply, or you burn them or incinerate them, or you go somewhere very far, you throw them, dispose them. But the best is deep burying or burning them off totally. Then you also see you can properly dispose, and then restrict movement around the birds. You have a family member or people who just come around, or even people who are customers who come to your farm to buy, to patronize you. They don't need to get close to your production site. They are restricted areas. Now, also, mind you this, when people come to buy things in your farm or wherever, be careful they don't always bring in the bags with the sack of feed. They don't bring them back, all those things. Things like trays of egg or egg tray, what you call crates of egg tray. Actually, the actual technical word is tray. Be careful of having them. Even vehicles, disinfect them, disinfectors, all those things that can come in. Even when you've gone out, you want to come into your own farm, wash yourself properly before you enter. We can't exhaust the list, but be careful, be always alert so you don't move viruses that can wipe out an entire farm. I want to wish you all the best as you keep on doing all that you do to make sure that your farm is safe. I hope you're safe. Thank you so much for watching. And if you have a question, there's any gray area, please make us know. You like the information, please like, share, and also let others know. Thank you so much for staying tuned. Let's do it again. Thank you. See you.